We are heading into the fall respiratory season and school is back. All this as BC experiences a spike in COVID-19 cases, as well as hospitalizations and deaths. But while Canada's first known case of the new COVID variant BA2.86 was detected in this province last month, it appears to be the only known case of that strain. That's according to the BC Centre for Disease Control. Well, to talk about the rise in COVID in BC right now and how the province is preparing, we're joined by Provincial Health Officer Dr. Bonnie Henry. Dr. Henry, good afternoon. Welcome to the program.
Good afternoon.
Can you go into further detail about the rise that we're seeing right now?
Sure. And, this is not unexpected. We know that there's been rises and the surges and waning of this virus over time. So to put it in context, it's much, much lower at this point in the year than it was last year. And last year it was lower than it was in 2021. So I think that's really important. It reminds us that COVID has become something, or the SARS-CoV-2 virus is something that is spreading. It will spread at different times of the year in more or less amounts, and we need to be aware of that. So it's not unexpected that we're starting to see an increase at this time of year, and we're starting to see some sort of a seasonality to this virus that's very similar to what we see with some of the other respiratory viruses.
So are you concerned then that given as that we are heading into respiratory season, that we may see a similar pattern as last year when we saw that, that so-called triple-demic of COVID, RSV, and influenza?
Yeah, I think we're in a different place than we were last year. And we're not seeing, like this time last year, we were starting to see all three of those viruses cause a lot of illness, in particularly in young people who hadn't been exposed to them for a number of years. So we're not seeing that same pattern this year, but it is still important to know that COVID is now going to be with us, and the SARS-CoV-2 virus is another one that we need to prepare for. But we know the things that we need to do that will help prepare us for this virus and for influenza, for RSV, and for all of the other ones that cause illness as we go into the fall and winter. And really important is to, cover your mouth when you cough, wash your hands regularly, stay home if you have a fever and a cough and you might be infectious to others. And important again this year is getting the updated vaccines now, both for COVID and for influenza.
Okay, I'll ask you about plans for that in a moment when it comes to vaccines. Given that we are in the second week of school and heading into that season once again, there are calls for return of the mask mandate in schools and at hospitals. Are you considering bringing back a mandate on masks?
Yeah, certainly not for schools. We've seen in the last year, we know how to deal with this in schools. We see respiratory illness in schools all the time. They're not the focus of where we're seeing transmission of SARS-CoV-2. But it's really important that we have all those things in place in schools and for people to make plans if a child is sick, not to send them to school. That's a really important line of defense. And to make sure kids get their updated vaccines. Influenza can cause serious illness in children, we know that, and so can COVID. So getting those updated vaccines will be really important. We are looking at healthcare settings as we go into the respiratory season. We know that there's more illness in the community, and sick people do need to go to hospital. And whether it's COVID or influenza or RSV or adenovirus or the other things that can cause people to exacerbate underlying illnesses or get sick with them. With the viruses themselves. So masking is going to be an important part of healthcare settings as we go into the fall.
Can we expect a mandate to come then in the coming weeks at healthcare facilities?
What we're looking at is not mandates in the same way that they were in the past, but updating our guidance for what we do for infection prevention and control during respiratory season. And so you'll be seeing more about that in the next week or so.
Will people be strongly encouraged? I mean, what will be the guidance when it comes to masking when going to the ER, for example?
I think people can expect that when you go into hospital during the season, when we start to see more viruses in the community, and we can know that you can be infectious before you recognize it in yourself. And when you're in those settings where people are most vulnerable, that masks will be expected.
Will be expected. Okay. And that will be through a rule?
Well, as I said, we're updating the guidance and the infection prevention and control guidance for all healthcare settings, and we'll have more to say about the details of that in the next week or so.
Okay, and what about for vaccinations? What is the plan for boosters? How effective might they be given new variants?
Yeah, we've been watching that very closely, and I think what people need to know is that Health Canada is reviewing the data on the effectiveness and the safety of the updated vaccines. So there's a Pfizer, a Moderna, and a Novavax, and they'll all be the XBB 1.5. So that's a good one that covers most of the variants. They're all sub-variants of Omicron that we're seeing out there right now. And we know that this vaccine seems to have good protection. And some of the data that we've seen, even against the BA 2.86, of which we've seen a small amount around the world, seems to show that this vaccine will protect against that too. So I have confidence that the new vaccines, the updated vaccines, are going to be our best protection against what we're seeing circulating around Canada and in BC in the coming months. So I really encourage everybody to get that updated booster as soon as it's approved and available. And we expect it'll be in the province in the next couple of weeks. And then people will be able to get that updated version. I think we also need to really take a step back and look at this virus now as being with us, and it's going to be with us for the foreseeable future. We're no longer in that emergency phase of the pandemic that we were in even last year. We're in a different place. We've got a lot of immunity in the community from people having multiple combinations of vaccination and infections. And we don't lose all that. It doesn't go back to zero when we have a new strain or a different version of the Omicron that's circulating. But the updated vaccine does do a couple of things. It helps give us the best protection we can against reinfection or infection itself. And it gives that boost to that cell memory, that memory immunity that protects us from the most severe infections and hospitalizations.
And do you expect that the rollout of a new booster would be similar to previous rollouts? Will there be some kind of expansion to accessibility? I heard those concerns fairly frequently on the program when for people who weren't able to travel to vaccination clinics and things like that. Will there be an expansion?
Well, what we're looking at this year is to have it much more available like we do influenza vaccinations. And we're hopeful. Our expectation is that both of these vaccines will be available around the same time, and that it's a much simplified program in that we're hopeful that the vaccines that are approved will be for all ages, the same vaccine. So that makes it much simpler. And in BC, we have a program that we can send out invitations to people. So as soon as we have vaccine in the province, people who are eligible, and that's everybody over the age of 6 months, will start being able to receive it. And it will be very much through pharmacies, through public health clinics around the province. So yes, we expect that there'll be an early availability, and we really encourage those most at risk to step up and get it first. And that's people over the age of 65, people with immune compromising conditions, and the people who care for them or live with people who are immune compromised. So healthcare workers, for example.
Okay. Would you roll them out in schools at all?
We have different, in different communities, schools are used as a place where people can receive vaccines, but we've also heard very much that families want to go together and get both their influenza and their COVID vaccines at the same time. So most of the clinics will be taking into account, what people need in each community.
Dr. Henry, thank you very much for joining us, and we look forward to the information that, as you say, is forthcoming in the coming weeks. Thank you for your time.
Thank you very much.